How do you heal from medical trauma after feeling betrayed? Imagine feeling vulnerable and trusting someone to help you, only to be let down or hurt in a way that feels personal. That's what medical trauma after betrayal can feel like. It's a complex experience that affects both your mind and your sense of safety. When medical care leads to distress or harm, it can leave lasting scars, especially if you feel betrayed by healthcare providers. This betrayal can make it harder to trust again, which is a key part of healing. Medical trauma often triggers symptoms similar to post-traumatic stress disorder, such as intrusive memories, anxiety, or nightmares. The good news is that healing is possible, and it involves a combination of approaches that focus on understanding your feelings, rebuilding trust, and managing symptoms. First, it's important to understand what medical trauma and betrayal really mean. Medical trauma can happen after any distressing experience related to healthcare, like misdiagnosis, invasive procedures, or feeling ignored or disrespected. When betrayal occurs, it damages the foundation of trust you might have had in your healthcare providers. This can lead to increased anxiety, avoidance of medical care, and difficulty engaging in future treatments. Recognizing that these reactions are normal responses to a hurtful experience is the first step toward healing. The core of healing often involves psychotherapy, which is a safe space to process what happened. Cognitive processing therapy helps you identify negative thoughts, like blaming yourself or feeling mistrustful, and guides you to see the situation from a more balanced perspective. Exposure therapy can help you gradually confront memories or situations related to the trauma in a controlled way, reducing fear and avoidance. Eye movement desensitization and reprocessing, or EMDR, is another effective approach. It involves recalling traumatic memories while following guided eye movements, which helps lessen the emotional impact of those memories. Narrative exposure therapy helps you create a coherent story of your experience, making it easier to understand and integrate the trauma into your life. Sometimes, medications are used alongside therapy to help manage symptoms like anxiety, depression, or sleep issues. Antidepressants such as selective serotonin reuptake inhibitors or serotonin norepinephrine reuptake inhibitors are commonly prescribed for post-traumatic stress symptoms. These medications can help regulate brain chemistry affected by trauma but should always be used under medical supervision as part of a comprehensive treatment plan. Because betrayal damages trust, part of healing involves restoring a sense of safety and control. Working with healthcare providers who respect your boundaries and prioritize your consent can help rebuild trust. Therapy can also focus on empowerment, teaching you how to advocate for yourself and make informed decisions about your care. Developing stress management skills like relaxation techniques, regular exercise, and maintaining healthy sleep habits can boost resilience and help you feel more in control. Connecting with others who have experienced similar medical trauma can be incredibly supportive. Group therapy offers a space to share your story, gain validation, and learn coping strategies from others who understand what you're going through. This sense of community can help reduce feelings of isolation and betrayal. Healing from medical trauma after feeling betrayed is a gradual process that varies for each person. It's important to work closely with mental health professionals to develop a personalized plan that fits your needs. Regular check-ins and adjustments ensure that your treatment remains effective and responsive to your progress. Remember, recovery isn't about forgetting what happened but learning how to live with it in a way that allows you to regain trust, safety, and peace of mind. If you're facing this journey, seeking professional help is a vital step toward healing and reclaiming your well-being.